Well, don't forget your teenagers when it comes to vaccinations. There are several shots they need as they grow up, and in some cases, immunity wanes. Joining us to talk about this topic is Stineman, a nurse from UnityPoint Clinic, Hiawatha Pediatrics. So, Kara, at what age should parents check back in with a pediatrician to see what their child may need in terms of vaccinations?
It's good to get that 11 to 12-year range. Go back to your primary care or pediatrician and meet up with them for physical and vaccinations.
So some of those vaccinations usually have about a 10-year lifespan?
Well, the three that they recommend at that age are the Tdap vaccine, which is a booster from the kindergarten vaccinations that they receive, the HPV, which is the for cervical cancer, and then the Menactra for the meningitis.
And you talk about things like you get into hepatitis and those types of things. Is that something that later in their teenage years they'd need, or is that something that they recommend also for that 11, 12?
It's usually just those three unless they miss those at their previous visits, and they can get caught up later.
Why is staying up to date on vaccines so important?
Well, the HPV is very common right now. It's the most common sexually transmitted virus. So it's a 3-series vaccination, and 90% of cervical cancers are caused from this HPV. So getting your children in before they're sexually active is really important to get that one. With the meningitis, they're more at risk when they're going into those college age years where they're living in closer areas. So getting them in, they need 2 of those vaccines 5 years apart, so it's important to get them in before then.
Yeah, I remember meningitis was a big thing when I was in college.
Yep.
None of us had the vaccination, and so then there was a run on that to get that done, so it's good to get it done ahead of time. What should parents do if they have some questions or concerns? There's always concerns about side effects of vaccinations. Where can they go to get some more information?
Obviously, they can call their primary care provider, ask questions to the nurses or the doctors, but they can also get information online, and it's important to use the correct site. So I would go to the Center for Disease Control, the cdc.gov/immunizations, and they can look up any information there.
Never such a thing as having too much information.
That's true.
Having the vaccinations you need to keep your family and your kids safe. Kara, thank you so much for being here.